7 of the strangest children born around the world. 7. Shalini, the snake-like skin teenager. A 16-year-old Indian girl is suffering from a rare condition where her entire skin sheds every 45 days. This adolescent girl, due to this rare skin disorder, has skin that resembles that of a snake. She is compelled to moisturize her skin daily with fatty creams to prevent it from hardening and peeling off. Doctors have diagnosed her condition as erythroderma or red man syndrome, an inflammatory skin disorder that is treatable. The severity of her skin condition is so alarming that despite moisturizing her skin every hour, only 3 hours of relief is achieved before her skin completely sheds every 45 days. Nevertheless, her family manages to afford the cost of the moisturizing creams, allowing her to cope with the constant skin shedding. Despite these efforts, every 45 days, her skin peels off entirely. The family struggles to provide for the expensive skincare routine, and as a result, the girl's condition continues to worsen. Shalini's life is challenging, facing the difficulties of a rare skin disorder. Is there hope for a cure for Shalini's snake-like skin condition? Her mother shares, Shalini has been afflicted with this condition since childhood. We consulted several doctors, but unfortunately, none could offer a solution for Shalini. When we see that there is nothing we can do and her skin gradually becomes fragile, she experiences pain, and we feel utterly helpless. While the disease is not fatal, it incrementally takes a toll on her life. No solution comes to mind, and they don't know whom to turn to for advice. Shalini's mother expresses the view that death might be preferable for Shalini over this kind of life. This condition has led to Shalini's classmates being frightened by her appearance, causing them to leave school, creating further challenges for Shalini. 6. Yuxin, the 1-year-old girl who appears to be 80 years old. A rare condition in a 1-year-old Chinese girl has caused her to look like an 80-year-old woman. Born in 2011, the girl named Yuxin has earned the nickname grandmother due to her unique illness. It is said that she is afflicted with a highly rare skin disorder called cutis laxa. Cutis laxa attacks the body's skin tissues, resulting in wrinkling, loosening of skin organs, and the elimination of young skin cells. This is an extremely rare condition, affecting only about 200 families worldwide. Currently, Yuxin, despite her appearance of an 80-year-old, is hospitalized and undergoing medical treatment and care at Zhengzhou Hospital in Henan Province, located in the central part of China. Chinese doctors mention that, although this child looks 80 years old, her activities and movements are just like a normal and adorable 1-year-old. 5. Yehonkrieg Carl, the Filipino boy with 300 teeth. Meet Yehonkrieg Carl, a young Filipino boy who has faced an extraordinary dental challenge. Born with an astounding 300 teeth instead of the usual 32, Yehonkrieg's story unfolds as his parents discover the unusual condition when he turned 2 years old. Initially, the parents kept the condition hidden, but when they noticed an excessive number of teeth, they sought medical advice. X-rays revealed a staggering 150 teeth by the age of 5, which later worsened, filling his mouth with a total of 300 teeth. In an attempt to alleviate the situation, Yehonkrieg underwent surgery to remove 4 teeth, but it became evident that he needed 7 more surgeries to eliminate all the extra teeth. The process is expected to take approximately 4 years. Despite facing difficulty in learning to speak, Yehonkrieg has overcome the challenge and excelled academically, becoming one of the top students in his school. 4. Shiloh Pepin, an American girl, outwardly resembled a mermaid. If she hadn't been affected by mermaid syndrome, she would have played and run like other children of her age. However, Shiloh never had a typical childhood, and her life was far from ordinary. At just 10 years old, Shiloh was the oldest among those afflicted with the rare mermaid syndrome. Born in 1999, her arrival caused quite a sensation. During that time, people were not familiar with such anomalies, and the birth of a baby with no legs and a tail-like appendage was considered extremely unusual. Hence, Shiloh quickly became a well-known figure. Doctors of the time had predicted that the mermaid-like child would not survive the first days of her life, but she defied the odds, growing older and larger. However, Shiloh's life was always fraught with difficulties due to mermaid syndrome. The syndrome led to her having only one kidney, and throughout the years, she faced numerous abnormalities. Not only did Shiloh lack a small intestine, but she also coped with fewer organs than regular humans. In 2007, she underwent a kidney transplant, but it brought no miracles. Slowly, Shiloh's kidney failure progressed, and she was taken to Maine Medical Center in a comatose state. After a week, she peacefully passed away at the age of 10. Shiloh was the world's largest mermaid, living up to the age of 10 and attending school. Her charm and likability touched the hearts of many, and news of her passing spread rapidly worldwide, prompting an outpouring of condolences. Occasionally, in some corner of the world, a baby is born in the likeness of a mermaid, challenging the myths of old for consecutive days. Mermaid syndrome, a rare congenital abnormality, manifests in the fusion of the legs at the extremities. 3. One-eyed child. The birth of an Indonesian baby with one eye in the forehead that shocked everyone. The newborn, with an unusually large eye on his forehead, sadly died after just 7 hours. This baby was the 5th child of Athena Arianantu and Suryantha. Weighing over 2 kilograms, all of her body parts were completely normal except for her face. Significantly, he lacked a nose and instead had a large eye in the center of his forehead, resembling the mythical Cyclops in Greek mythology. Suryantha, the baby's mother, had never had an ultrasound during her pregnancy, so she was unaware of her child's rare condition. Seeing the baby's face, he was completely shocked. Nevertheless, the doctors put the baby in an intensive care room and checked every 15 minutes. Despite all efforts, unfortunately, the baby died. 2. Birth of a unique four-limbed newborn. A newborn weighing 2.950 kilograms arrived in the Shahabad Community Health Center in Hardoi, northern India, in the state of Uttar Pradesh. This extraordinary baby had 4 extra limbs, emerging from its abdomen. The mother, who chose not to disclose her surname, was transferred to the hospital after experiencing labor pains, and immediately gave birth. Despite the rarity of this condition in the field of medicine, both the mother and the newborn miraculously remain healthy. The infant also had 4 additional limbs, with the extra appendages forming on its abdomen. Despite this anomaly, the baby is reported to be in good health. News of the extraordinary birth has spread around the region, capturing the attention of local residents. People have flocked to the hospital to catch a glimpse of the newborn, with some referring to the baby as a marvel of nature. Others have suggested that the infant might embody the reincarnation of the goddess Lakshmi, with multiple hands symbolizing prosperity, abundance, well-being, wealth, success, and happiness. 1. The extraordinary baby with the largest head in the world. The Indian baby with the largest head in the world, due to suffering from a rare condition called hydrocephalus, has recently undergone surgery, and with the help of doctors, his head size has significantly reduced. This Indian child, afflicted with hydrocephalus, where an abnormal accumulation of fluids causes an unusually enlarged skull, has undergone a surgical procedure to address this condition. Born 7 months ago, the baby is on the path to recovery, with doctors successfully draining approximately 3.7 liters of fluid from around his brain during the hospital stay. The infant, who had the world's largest head, with a circumference reducing from 96 to 70 centimeters after the surgery, is showing remarkable improvement in cognitive function and overall physical condition. Having been born on November 20th, he has been making progress since the surgery, and the medical team remains hopeful for his continued recovery. Hydrocephalus in children under 2 years old can result from the open fontanelles leading to unnatural skull enlargement. After months of hospitalization and fluid drainage, the baby is responding positively to the medical intervention. Physicians have reported that the infant is currently undergoing the stages of recovery post-surgery. Hydrocephalus in children is often linked to congenital abnormalities, narrowing of brain passages, or neonatal infections. In adults, it can manifest as walking difficulties and memory impairments.